The circoviral disease of swine. The porcine circovirus. The occurrence is worldwide, but it's a decreased problem due to vaccination protocols. Porcine circovirus 2 is endemic all over the world. The general characteristics of circovirus is they're ssDNA circular, which means the DNA is infective. They're non-enveloped, which means they're very resistant, and they use the cellular polymerase enzyme to replicate in dividing cells. The etiology is that the circovirus genus, so the porcine circovirus, has various genotypes. The ancestor is the nanovirus and the calicivirus. There are 4 types. Porcine circovirus 1 is a non-pathogenic. Porcine circovirus 2 is the most common. Porcine circovirus 3 causes reproductive problems, and porcine circovirus 4 is non-pathogenic. Porcine circovirus 2 can be subclinical or can cause a systemic infection in the case of PMWS, which is porcine multisystemic wasting syndrome, or PDNS, which is porcine dermatitis and nephropathy syndrome. And the epidemiology of the disease, it's maintained by wild boars and rodents. Mice and rats are biological vectors and persistent carriers. The infection comes from feces, feed, water, and direct contact, and discharges and different secretions, such as urine and semen. It's an immunosuppressive virus, and secondary bacterial infections are common. It can also cause intrauterine infections, which affect the fetuses. It replicates in the fetus's heart and can cause abortion. For the pathogenesis, the infection enters the body through the oral nasal route. The primary replication happens in the throat, especially the tonsils and the lymph nodes. It can cause viremia for 1 to 2 weeks, and the virus replicates in monocytes, so macrophages and dendritic cells. The virus uses cellular polymerase to replicate in rapidly dividing cells. These are lymphoid cells found in the lymph nodes, spleen, and thymus. The first result of the disease is a subclinical infection. This can cause immunosuppression, which leads to an economic loss. This is due to the virus destroying the monocytes. The AP cells undergo apoptosis, and the B cells and T cells are destroyed. Secondly, the virus can cause porcine multisystemic wasting syndrome, also known as PMWS. It's endemic to Asia and the EU. The clinical signs are seen from 5 to 12 weeks. It happens in piglets post-weaning, over the ages of 1.5 months. It results in fever, anorexia, lethargy, depression, jaundice, ascites, and weight loss. It can also cause nervous signs and respiratory signs such as cough and dyspnea, and it also causes diarrhea. Pregnant sows with this disease have abortions, mummifications, and stillbirths. The virus replicates in the fetus's heart, which causes myocardial necrosis. The main part of the pathology is that the lymph nodes are enlarged. They're about 3 to 4 times bigger than normal. The animals can also get hepatitis, enteritis, and interstitial pneumonia, and a secondary bacterial infection, which causes PRCD, which is porcine respiratory disease complex. The lungs are not collapsed, but they're heavy. And the pigs can also get hemorrhages, which is porcine dermatitis nephropathy syndrome. And in the histopathology, expect to see lymphocyte depletion and lung edema. The next part of the disease is porcine dermatitis nephropathy syndrome. It happens when the animals are around 30 to 100 kilograms. This is the outcome in the case when there is a very high amount of antibodies against porcine respiratory virus 2. It forms immune complexes with the antigen and antibody, and it deposits them in the kidney, skin, and blood. In the kidney, it causes glomerulonephropathy. In the skin, it causes hemorrhages, and in the blood, it causes vasculitis. This immune complex causes a type 3 hypersensitivity. The clinical signs are multifocal circular red skin lesions. So on the skin, you see hemorrhages, edema, weight loss, and heavy breathing, fever, lethargy, and anorexia. In pathology, expect to see an enlarged brownish greyish kidney with Petechi hemorrhages. You can see vasculitis in the blood, and glomerulonephritis in the kidney, and skin hemorrhages and edema. With the skin hemorrhages, you should always make sure the differential diagnosis is that it's not African swine fever. With the skin hemorrhages, you should always make sure a differential diagnosis could be African swine fever and classical swine fever. The fourth part of the disease is porcine respiratory disease complex. This usually involves the porcine circovirus 2, but it also can include other viruses such as swine influenza, PRRSV, Mycoplasma, Pastorella, and other pathogens in the environment. It affects animals at 16 to 22 weeks. It causes fever, lethargy, and respiratory problems. For the diagnosis, you can use PCR, ELISA, IF, and immunohistochemistry. The isolation is difficult due to the lymphoid cells. The treatment is to support the immune system and give antibiotics for a secondary bacterial infection. The prevention is to vaccinate for the sow and for the piglet. Use an inactivated vaccine or a recombinant vaccine. Farms should do a vaccination protocol, and for porcine circovirus 3 infection, expect reproduction problems and abortion.